I want to pick up now on something that you sort of alluded to a moment ago, sort of about trust in institutions and funder responsibilities and things like that. So do you think there is or rather, what do you think is the role of funders and institutions, research institutions like universities, in promoting more diverse science?
So over the past few years, I will say, and especially within the last year or so, I've seen where, with all the unrest that has occurred in the United States, there's this push towards, we need to be more inclusive, we need to diversify the workforce, we need to do more research in this area. And I think that's great. But I also think that, and I try not to be pessimistic, but there's a part of me that just think, wow, are we really going to get individuals who are truly interested in this topic, who are vested in it and really want to understand it? Or are we going to get people who are chasing the money, chasing the funds? I think the system is set up in such a way, and I don't fault researchers. You are in an academic institution where a certain percentage of your salary comes from getting grants. And as such, you have to go where the funding is, right? So if you cannot get funds for your research, then you have no salary for yourself. So I find that people sometimes jump from topic to topic because that's where the money is. And so they can actually get that from money. And so I think sometimes the academic institution themselves, as well as the funding agency, the funding institution, because of the call for these things and where they put the emphasis, it gets people doing research that might not necessarily, and this is probably controversial and people might not agree with me, but I do think that by doing that, you have people going into these areas and doing research when they're not necessarily as invested in it. And unfortunately, this have all these negative consequences because you do then, so researchers get the money, they get it to do a particular research. They go into communities, build trust, go into communities to start their research, and they set up whatever research protocol, whatever they're collecting data on, whether it's to provide healthcare for a period of time, to different kind of interventions, whatever. And so they go into these communities, and when they go into these communities and the communities buy into this thing and they start doing the research and they collect the information, when the funding is done, they pull out of those communities. Whatever they've set up, it's not sustainable. So this happening over and over again creates a sense of a mistrust of the communities in research and researchers. Because and I've gone to communities and tried to say, we're thinking about doing the research, and they're like, well, what is it? What is it? What is in it for us? If you come into our community and you do this, what do we get out of it, and what happens when you leave? And they've actually said this. Research has been done on our communities so many times, and each time the academic institution complete their research, because they've collected the data that they need, and they pull out, there's a void that's left because it's not sustainable. So I think, and I've been pushing, and I've been saying this to funders, that I get it, and I realize that community participatory research tend to not be the type of research that gets funded, but I think more funding need to focus on this. But you get into these community, but you have to help the community build the community so that when the academicians pull out, there's some kind of sustainability, something that they can continue to work with, and help the community that can then also reduce or deal with mental illnesses in the population and help to reduce the risk for suicide. So I don't think it's necessarily that, I don't think it's that it's deliberate when these things happen, but I think it's a negative consequence of, we need to get the funds, we need to go get the research, we need to collect our data. And so you get into these communities, you collect your data, but then you leave because your funding has run out. It's not necessarily that you want to. And so when you leave and when your funding has run out and you leave the community, you leave a void. And with that void, build more and more mistrust for research and for academic institutions.
And then this has a cumulative effect, of course, that the next researcher who comes along then there's already that mistrust there.
There's that mistrust there. And then you have to think, if you think of the Black community, you have to think, when I think of, you have to think about research studies that have been done that has actually taken advantage of Blacks, African Americans. You've come in, and I think of the Tuskegee Experiment, the study that was done where researchers went in and they did their study, and when Black men thought they were getting treatment for syphilis, they weren't. They were getting these placebo injections, and so, or treatment, and so they had all these negative outcome as a result. Unethical. This was done many, many years ago, but the history of that still stays in the mind of Blacks, and it makes them just not trust healthcare, and it makes them just not trust research. And then, of course, on top of that, there's this stigma associated with mental illness and suicide in the Black community. And this is also related to that mistrust, but this is there too. So you have to think about the historical mistrust, the mistrust that's keep building over time for all these research that's been done and then pulled out. And then on top of this, the stigma. And so they're just not participating. They're not acknowledging some of the issues that are going on as well. So they just don't trust the system. And so I think something needs to be done to rebuild that trust. And so it's going to require researchers, clinicians, and the community coming together and kind of rolling up their sleeves and working on these things together to kind of rebuild that trust. It's going to take a lot. Mm-hmm. And I think that is having an effect even right now on the COVID and the COVID vaccine. It's just a mistrust, and that lack of, I don't like to use the word mistrust because I feel like I don't want it to be a blame on the Blacks that they, but I wanted to acknowledge that it has a lot to do, because it's not the Black person, oh, it's because of your mistrust. It's all of these things that have happened that led to that lack of trust. And, it might be a subtle difference, but it's that lack of trust that's there. And it's going to take a lot to kind of rebuild trust. And we know that when trust is broken, it's really hard. So you're going to have to try to rebuild that trust to then get the community re-engaged to participate in research and to do some of the stuff that we do need them to do for us to better understand what's going on with the Black community and what's causing some of the increase in suicide that we've seen, and for us to better do suicide prevention for that group. But yeah.
I think that's such an important about sort of building trust and building these relationships, because in research, when the grant money's up, frequently then move on to something else or something like that. And especially then, as you said, if funders are perhaps sort of producing these kind of special calls for diversity related research, which are then being answered by people who don't necessarily have a sort of long history or a relationship with the Black community or with other diverse communities, then that is a very abrupt stop to a relationship that's perhaps sort of being built up with the community then. Do you think then, when funders are sort of making these special calls for research focused on diversity, then there's this unintentional sort of side effect that maybe people are doing this research without fully engaging in it, sort of a bit, because they have to sort of tick particular boxes, if you like, and it's a sort of diversity washing almost in research, that ostensibly perhaps they're engaging with diversity then, but they're not meaningfully maybe engaging with those communities then.
Yeah, and I do believe that you do have people who are not Black who are participating in research, and they're really and truly, honestly, this is really what they're very much invested, want to know what's going on, and want to engage with those communities and try to help them. And so I think, so I want to make sure, I want to separate that. I'm just simply saying there's this risk that you're going to have people, an influx of researchers who it's not in their heart, they're not as invested in this area of research. And so they might be going in to do these research. So I think when funders are putting out these research, we have some changing course a little bit. There's a patient-centered outcome research institute here at in the United States, and as part of their application process, you cannot, so you can, but they tend to fund research where in your research you have to have a community advisory panel, community advisory board. You have to have a few community members, consumer members who are part of your research study to help guide it. And as such, that's what I think, that even if it's and the National Institute for Mental Health, whether it's the American Foundation for Suicide Prevention, whoever is putting out these calls for application or for research in these areas, I think part of the what they should be requiring is that if you're proposing a research, you have to make sure you have members of the community that you're going to research be part of this to help inform it and help you figure out ways that even when the research study is done, there's some sustainability. So I'm not saying don't do your call for application, because I think it's important to do research in this area. And I'm excited that funds are being put aside to do this research. But how do you set it up such that when research are being done, the community is involved and research is not good, that negative consequence that I talk about doesn't occur? How do you set that up to make sure that that doesn't happen? So that's what I think is going to be important for funding agency to take into account. I don't know, I know PCORI does, but I do hope that NIMH and other funding agencies will start to move towards that as well, to make sure that their community advisors, consumer advisors as well, participate on these panels as researchers plan out their research, especially in this area where we're talking about diversity. And then again, another thing too is that it's not just that, it's not important for researchers to only just put race and ethnicity. They need to also think about some of the other factors that are related to race and ethnicity. So it's the discrimination, the social determinants of health. So you have to broaden, and you can't just focus on race, because when you do that, you're missing all of these issues. So including race is fine, but you also need to make sure that it's not just race, but they're broadening whatever that definition is and making sure that they're including other social determinants of health in their research.
Oh, that's a great point as well about thinking about the broader social determinants. So just as we're sort of drawing to a close then, one last question. So you've mentioned quite a few different sort of ideas then today about how we can work together to try and improve things in terms of ethno-racial diversity and suicide research. What do you think are the most important next steps so that for suicide research then it's not just a case of becoming more diverse, but so that it's a case of becoming more actively anti-racist? What do you think are the key next steps there?
So I think the key next steps would be we need to, it's great that you're putting money out, but I think even just in planning that part, okay, what are we going to look at, and what we need to bring community members into that conversation. I think that's important. I think sampling strategies need to change. And so I think researchers need to, and the sampling strategy is going to also be related to the methods, what the research question they're thinking about, the methods they're thinking about using. But I think more and more these research studies need to be driven by a theory. You need to have a theoretical framework that's going to guide what you're doing. And I'm not seeing that a lot. I see research studies that just say whatever, oh, I'm looking at this, and I'm like, okay, but why? And I don't always get the why. So that's more important. I think that's important for people to do. I also think that to make sure that it doesn't become anti-racist, it needs to be making sure that funding, when you're distributing your funding, the population of researchers that this funding's going to, it's a diverse population of researchers. And I'm also saying a diverse population of researchers, and not just simply you still have the same set of people doing research, and then they tack on two people on their research studies, most of the time junior, and you tack them on your research, but then the research is still being driven by the other person. So I just think, take a risk. There are lots of good researchers that are out there. There might not be, as I said, the quantitative research, but how can we bring them to the table? So these people who are doing more qualitative research can partner. So they're leading the project, but they're partnering with other quantitative researchers to help guide the research that they're doing. I think it's going to be a different lens that funding agency and that the academic institution and researchers will have to use as they try to make sure to continue looking at this diversity issue, but making sure that the research that they do don't in and of itself turn out to be create these racist thing unintentionally, right? Mm-hmm. For example, I think few papers have been written talking about the use of predictive analytics and using race in these predictive analytics. And even though the data was collected not necessarily in the way to look at biology, the data is being used as if race indicate biology without taking into consideration all the social determinants of health and all these other factors. And then using that predictive analytics to then distribute healthcare.
Yep.
And then it's and actually having and distribute resources, and then it's actually having a negative effect because Blacks are actually being denied certain treatment. They're then experiencing certain things just based on this predictive analytics. So instead of being helpful, it's actually perpetuating that discrimination and racism. So that needs to be done. So it's going to be conversations with people coming to the table together and a change, more mixed methods and broadening the scope. We have to look at the social determinants of health along with race and ethnicity, and then looking at different methods that we can use.
Diana, thank you so much. That's I've learned a huge amount from speaking today, and I could happily talk to you all day about this and listen to you all day about this. But we are out of time, unfortunately. So thank you so much for joining and for sharing your incredible expertise and experience here. I'm sure this will give people lots of food for thought. Thank you very much.
Yeah, and thanks for making this a topic. So really appreciate it. Thank you.
Thank you.